Welcome to the deep dive.
Great to be here.
Today, we're really getting into this complex world of mania.
Yeah, it's a big topic.
We're using a detailed psychiatric overview as our guide, really, to map out what mania actually is.
Hmm.
You know, people use the word manic pretty casually sometimes,
They really do.
but we want to go deeper, look at the clinical side, the symptoms, the potential causes, and treatments.
Exactly. The goal is to get a clearer picture, right? Move past those common ideas.
Yeah, highlight what's really going on.
And our source material, it really lays out that mania isn't just being hyper. It's a significant psychiatric behavioral syndrome.
These syndromes.
Yeah, fundamentally involving this abnormal kind of sustained elevation in arousal effect. That's your emotional state, basically.
Right.
And just overall energy levels. Psychiatrists might also call it, manic syndrome or a manic episode.
Okay, so let's dig into that elevated mood bit, because I think most people, when they hear mania, they just picture, like, extreme happiness, right?
That's a really common thought, but it's a crucial point that it's more varied. Euphoria, that intense feeling of elation, yeah, that can be part of it.
Can be.
But the elevated mood can also be dysphoric.
Dysphoric. How so?
Think of it like a state of unease or dissatisfaction, sometimes really intense restlessness or agitation.
Ah, okay.
And often, as an episode progresses, irritability can really ramp up. It can become quite dominant, even leading to anxiety or outright anger.
So definitely not just feeling super happy all the time.
Not at all. It's a much wider range of intense emotion.
That really changes the common perception, doesn't it?
It does.
And it makes you think about how it relates to depression. Are they just, like, polar opposites?
Well, the traditional view often paints them that way, yeah,
Yeah.
as opposites on a single spectrum.
Uh-huh.
But the source we're looking at suggests it might be more nuanced. There's this idea growing in clinical practice that maybe mania and depression are more like independent dimensions. Yeah, possibly operating on separate axes within a, broader mood spectrum. The existence of mixed states really points towards this possibility.
Mixed affective states. Okay, that sounds complicated. What is that?
It means someone meets the criteria for hypomania or even full mania,
Right.
but at the same time, they're experiencing 3 or more significant symptoms of depression.
Wow. So both high energy and low mood features at once.
Exactly. And that combination is particularly worrying because you have the low mood, the despair, but also the increased energy and drive from the mania.
Which could lead to.
Sadly, yes, it can increase the risk for suicide attempts. It's a very dangerous state.
That's a really stark reminder of how serious this can be. Okay, so moving to symptoms people might recognize more. What are some key things you'd see in someone experiencing mania?
The core symptoms really highlight that amplified state we talked about.
Yeah.
So beyond the mood changes, you often see flight of ideas,
Flight of ideas.
which is like rapid, often disjointed shifts between different thoughts, and pressured speech.
Pressured speech.
Yeah, speech that's really fast, maybe loud, and it feels like you almost can't interrupt them.
Okay.
Then there's a definite increase in overall energy, a much lower need for sleep, like feeling rested on very little sleep.
Right, you hear about that a lot.
Yeah, an increased physical activity or restlessness, hyperactivity, basically.
Okay, that reduced need for sleep is striking. But the flight of ideas, what does that actually feel like for the person? Is it just thinking fast?
It's more than just fast. Imagine your thoughts are like racing uncontrollably, jumping from one topic to another.
Okay.
And the connections between those thoughts might be really loose or maybe not even there. You find yourself easily distracted by, I don't know, unimportant stuff around you.
Stuff you normally wouldn't notice.
Exactly. So focusing on one thing becomes incredibly hard. You might feel or seem really absent-minded.
And I guess that makes sleeping even harder.
Absolutely. That mental whirlwind makes it very difficult to switch off, to relax, and actually get proper rest.
Sounds overwhelming.
Yeah.
And you mentioned the source talks about a progression from hypomania up to full mania. What's the difference there?
Right. Think of hypomania as sort of mania light.
Okay.
The symptoms are similar in type, the elevated mood, more energy, faster thoughts, but they're less intense.
Less severe.
Less severe, exactly. And crucially, hypomania doesn't always cause major problems in someone's day-to-day life, like work or relationships. It might not significantly impair their functioning.
Ah, I see.
But when those same symptoms really escalate, become much more pronounced, and start causing clear difficulties or maybe even lead to hospitalization, that's when it crosses into full-blown mania.
And in really severe mania, psychosis can happen. That sounds like a major step up.
It is. In the more severe episodes, yes, the picture can get much more complex. Psychotic features can emerge.
Like what?
Things like delusions.
Yes.
These are strongly held false beliefs. They might be grandiose.
Believing they're incredibly important or powerful.
Precisely. Or they could be paranoid delusions involving intense suspicion, feeling like others are out to get them.
Okay.
Hallucinations can also occur seeing or hearing things that aren't there. And behaviorally, you might see things become very disorganized, fragmented, in some rare, severe cases, even catatonia.
Catatonia, like problems with movement.
Yeah, marked disturbances in motor activity, either being very still or agitated.
Wow. The source also mentions the subjective side, what it feels like inside for the person. What's that like?
Yeah, internally, people in a manic state often feel this powerful sense that their goals, their plans are incredibly important, almost like a mission they have to complete. They might show a real disregard for potential negative consequences of their actions, a feeling of maybe invincibility.
So nothing can go wrong.
Yeah, lack of the usual restraint, sometimes believing they have special insights or talents nobody else does. And this internal state really drives a lot of the outward behavior changes.
Okay, like what kind of actions might you see that are out of character?
Well, we're talking about things that are really different from how the person usually is. Maybe making impulsive, risky business deals.
Right.
Or going on big spending sprees they can't afford, engaging in risky sexual behavior, maybe substance abuse starts or increases, excessive gambling.
Just generally reckless stuff.
Generally reckless behavior, yeah, without really thinking through the potential harm. Even social interactions can shift, maybe becoming overly familiar with strangers or getting into loud arguments easily.
It sounds really tough.
It's vital to remember these actions are often a direct result of the mania itself, and they can have really serious, lasting consequences.
It sounds like a profoundly difficult, maybe frightening experience. Not just for them, but for family and friends, too.
Absolutely. For everyone involved.
And the source notes that sometimes the person experiencing mania might actually deny anything's wrong. That seems like a huge barrier.
It really is. A lack of insight or reduced awareness is unfortunately quite common in mania.
Why is that?
Well, the person might feel fantastic, incredibly energetic, confident, on top of the world, so it's very hard for them to recognize that their thoughts, feelings, behaviors are actually problematic or outside their norm.
Yeah.
And that lack of awareness, it definitely makes seeking or accepting help much, much harder.
Let's circle back to hypomania for a sec. You said mania light, not always impairing things.
Right.
Now, I've definitely heard it linked, almost romantically sometimes, with creativity, like periods of intense creative output. Is there scientific backing for that?
That's a really popular idea, you're right. And you do hear anecdotal stories linking that higher energy with creativity.
Yeah.
But interestingly, a recent big review, a meta-analysis looking specifically at this, it found that assumption might be, well, a bit too simple.
Oh.
The solid, consistent research evidence for a direct causal link between hypomania and boosted creativity, it's actually lacking right now.
Huh. That's interesting. It kind of deflates that common notion.
It does seem to, based on the current research landscape.
Okay, so even if it's not directly sparking genius ideas, what are the defining features of hypomania itself?
Well, similar to mania, you see that reduced need for sleep, you see increased goal-directed activity, maybe a higher metabolism overall. Though brain metabolism studies during hypomania have actually given sort of mixed results. Some show abnormalities, others don't find big differences from baseline, so it's not totally clear-cut there.
So even though it might feel productive, are there downsides to hypomania? Risks?
Oh, definitely. Even if the mood is more irritable than euphoric, that can be really unpleasant for the person.
Right.
But even with a more positive feeling mood, people in hypomania can show excessive optimism that's just not realistic. Feelings of grandiosity, exaggerated self-importance, and a tendency to make poor decisions without really weighing the consequences.
So still risky behavior is possible?
Potentially, yes. Maybe not as extreme as full mania, but poor judgment can still lead to problems. And maybe the biggest risk is that prolonged hypomania can sometimes escalate.
Into full mania.
Into full mania, yeah. And the person might not even realize it's happening, that they've crossed that line.
That really highlights why recognizing even these seemingly milder states is important. Okay, so moving on. The source talks about causes and associated conditions. What's the main connection?
The biggest one, the primary association, is definitely bipolar disorder.
Right.
In fact, having just one manic episode, assuming it's not caused by, say, drugs, or a medical issue is often enough for a diagnosis of bipolar disorder.
Just one episode.
Often, yes. And hypomanic episodes, as we discussed, they're a key part of bipolar 2 disorder, which also includes major depressive episodes.
Okay.
But it's important to know mania isn't only in bipolar. It can show up in other psychiatric conditions too, like schizoaffective disorder, the bipolar type.
And what about other things? Medical conditions, external factors triggering mania. You mentioned secondary causes.
Yes, exactly. There's a whole range of things that can cause what's called secondary mania.
Like what?
Neurological conditions like multiple sclerosis, for instance, endocrine problems like hyperthyroidism, even nutritional issues like a severe vitamin B12 deficiency.
Wow. Right.
Certain medications are known culprits too. Corticosteroids like prednisone are a big one.
Prednisone, right.
Substances of abuse, especially stimulants, amphetamines, cocaine can definitely trigger manic states. Other triggers can include the period after childbirth in women, sometimes called postpartum psychosis,
What?
strokes, especially if they affect the right side of the brain.
The right side. Interesting.
Yeah. Also, deep brain stimulation for certain conditions if it targets a specific area, physical trauma or other serious medical illnesses, and even a seasonal link, with some people more prone to mania in the spring.
That's a surprisingly diverse list.
Yeah.
It really shows mania isn't always just, a primary psychiatric thing.
Absolutely. Differential diagnosis is key.
So how do professionals actually diagnose and classify it then? Using things like the DSM.
Exactly. The main classification systems, the DSM-5 and the ICD, both have specific criteria. They help distinguish hypomania from mania, and they also grade mania severity, mild, moderate, severe.
Okay.
According to DSM-5, for a manic episode, you need that persistently elevated, expansive, or irritable mood, plus the increased activity or energy, and it has to last at least a week.
A full week.
Usually, yes. Unless the symptoms are so severe that the person needs to be hospitalized, then the duration can be shorter. And critically, this whole picture has to cause significant problems in work, social life, or require hospitalization or involve psychosis. And importantly, it can't be just due to taking a substance or having another medical condition.
Got it. And there are specific accompanying symptoms needed too, right? Not just the mood and energy shift.
Correct. DSM-5 lists several. During that period of altered mood and energy, you need at least 3 of these symptoms, or 4 if the mood is only irritable.
Okay, what are they?
Things like inflated self-esteem or grandiosity, sleeping much less but feeling rested, being way more talkative or feeling that pressure to keep talking, thoughts racing or feeling like thoughts are speeding up. Also, an increase in goal-directed activity socially, work, sexually, or that physical restlessness, psychomotor agitation, being easily distracted.
Right.
And finally, getting excessively involved in activities with a high potential for painful consequences. Those spending sprees, risky investments, sexual indiscretions we talked about.
Wait, that's quite specific.
And if they're completely separate psychiatric conditions, not related to the mood state of mania or bipolar disorder, despite the confusing suffix.
Good to clarify. Okay, so we have a clearer idea of what mania is, how it shows up, what it's linked to, but what's actually going on inside the brain, the biology.
Yeah, that's the million-dollar question, really. It's a huge area of research, and honestly, the precise mechanisms aren't fully nailed down yet.
Still figuring it out.
Still figuring a lot out. But neurocognitive studies consistently point towards some kind of dysfunction in the right prefrontal cortex.
The right prefrontal cortex involved in decision-making.
Exactly. Planning, inhibiting impulses, executive functions, studies on brain tissue after death, and research looking at how anti-manic drugs work, they suggest potential issues in several brain chemical pathways. Things involving GSK3, dopamine, protein kinase C, inositol monophosphatase. These are all enzymes or neurotransmitters involved in how brain cells communicate and function.
Okay, complex chemical signaling.
Very complex.
And has brain imaging, like fMRI, shown anything consistent?
Yes. Large analyses combining results from many imaging studies have found some patterns. Things like increased activity in the thalamus, the brain's sort of sensory relay station.
Okay.
And interestingly, reduced activation in the inferior frontal gyrus on both sides. That area is involved in stopping behaviors and processing emotions.
Reduced activation there.
Yeah.
So maybe less braking.
That's one way to think about it, yeah. Less inhibition. There's also often increased activity in the amygdala, which handles emotions, and the ventral striatum, part of the reward system, though those findings are a bit less consistent across all studies.
Right.
And there's evidence for weaker connections, less coordinated activity between the ventral prefrontal cortex and the amygdala, again suggesting problems in regulating emotion and behavior.
You mentioned the right hemisphere earlier.
Yeah, remember how strokes on the right side are sometimes linked to secondary mania? That fits with this broader picture. Right hemisphere damage seems more associated with mania, while left hemisphere damage is more often linked to depression.
Fascinating.
And one prominent theory now is this idea of reward hypersensitivity.
Reward hypersensitivity.
Yeah, both behaviorally and in the brain's reward circuits. The idea is that the brain might be over-responsive to potential rewards, maybe combined with being less sensitive to potential punishments or negative outcomes.
So the gas pedal is floored and the brakes are weak.
That's a decent analogy, yeah. The pleasure or reward systems are potentially overactive, while the systems that signal caution or negative consequences are underactive.
That's a lot of complex brain stuff. Really shows how intricate this is biologically.
It really is.
So given all that, how is mania actually treated? What's the approach?
Well, the absolute first step before any treatment for the mania itself is that thorough check for secondary causes.
Rule out the medical stuff, the substances.
Exactly. Got to make sure it's not being caused by something else that needs its own treatment. Then, for treating an acute manic episode, the main goal is to stabilize the mood quickly and manage those immediate symptoms.
Okay.
This usually involves medications. Mood stabilizers are key drugs like carbamazepine, valproate, lithium, lamotrigine, and also antipsychotic medications are often used: olanzapine, quetiapine, risperidone, aripiprazole, and others.
Mood stabilizers and antipsychotics.
Often in combination, especially initially.
And what about long-term? Preventing future episodes.
Right. That's the goal of long-term or prophylactic treatment, preventing recurrence of both mania and depression. This usually means staying on mood-stabilizing medication long-term,
Okay.
often combined with psychotherapy, talk therapy, and really emphasizing a healthy, regular lifestyle, stable sleep, managing stress, things like that.
Makes sense.
Lithium is still considered a classic, very effective mood stabilizer for long-term prevention. Certain anticonvulsant drugs are also widely used for this maintenance phase.
Mm-hmm.
Sometimes benzodiazepines meds like clonazepam or lorazepam might be used short-term, especially early on, to help with severe agitation or anxiety. Lorazepam might be combined with haloperidol in an emergency setting. But one really critical point. Using antidepressant medication alone is generally not recommended for treating depression in someone with bipolar disorder.
Why not?
Because antidepressants by themselves can actually carry a risk of triggering a switch into mania or hypomania. So they're usually used very cautiously, if at all, and almost always alongside a mood stabilizer.
That's a crucial point. Okay, lastly, the source touches on that intriguing connection again. Media, creativity, society. We talked about the lack of strong research evidence linking hypomania and creativity directly.
Right, the evidence isn't really there in a strong causal way.
But are there notable anecdotal accounts or broader observations?
Oh, absolutely. Despite the lack of definitive research proof, you hear countless stories, and there is some evidence suggesting maybe a higher rate of bipolar disorder in creative fields.
And examples?
Well, there are memoirs like Electro Boy by Andy Berman, which gives a really vivid personal account of mania. Historical figures like Winston Churchill are often discussed as possibly having experienced periods like this. And contemporary figures, too, like the actor Stephen Fry, who's spoken very openly about his bipolar disorder, including manic behaviors in his youth and reflecting on how it's impacted his life and work, both good and bad.
Right.
And it's interesting just to look at the word mania itself. Its roots are in ancient Greek words for madness or frenzy. So there's clearly been an awareness of these kinds of extreme states for a very long time.
Yeah, even if the creativity link isn't scientifically solid now, what do you think led to that assumption becoming so widespread?
It probably stems from that subjective feeling some people have during hypomania, maybe. That increased energy, the rapid thoughts.
Right.
It might feel like inspiration or heightened productivity to them.
Right, the subjective experience.
Yeah, but it's so important to separate that feeling or even a correlation from actual causation. And also to remember that full-blown mania with the potential chaos and dysfunction is much more likely to hinder creative work than help it.
That makes sense. It's fascinating how these intense states have been seen over time and how our understanding keeps changing. Okay, so as we wrap up this deep dive on mania, what are the absolute key takeaways we should hold on to?
I think first and foremost, just understanding that mania is way more than just being happy or energetic. It's a really complex psychiatric state.
Mm,
It involves major shifts in energy, thinking, behavior. It can show up differently: euphoric, dysphoric, irritable. It can even involve psychosis in severe cases.
right.
Second, remember the diverse causes. It's strongly linked to bipolar disorder, yes, but secondary causes, medical conditions, substances are really important to consider.
Crucial for diagnosis.
Absolutely. Accurate diagnosis using standard criteria is essential, and management usually involves medication, like mood stabilizers, often combined with therapy and lifestyle strategies long term.
Okay.
And finally, that link with creativity. While it's a persistent idea in culture, the current science doesn't strongly back it up as a direct cause and effect relationship. It's more complex than that.
That's a great summary. Really hits the key points about the complexity and the need for, a properly informed view.
Definitely.
So here's a final thought for you, our listener, to maybe mull over. Considering how intense mania can be, the potential consequences, and its strong link to conditions like bipolar disorder, what does this all mean for us as a society? How should we understand and support people experiencing these states? And maybe, how can we keep working to reduce stigma and build more informed, more compassionate approaches to mental health? Approaches that really acknowledge the complex reality of conditions like mania.